Barry and Jakob, what are your questions for today? Jakob, what topic have you prepared for today?
I didn't prepare today.
What?
Sorry, I had problem with internet.
But what topic you prepared? Besides you having trouble with the internet.
Hello?
What topic have you prepared, Jakob?
Yeah, no, I didn't prepare, sir.
Nothing?
Yeah, because,
So start preparing now then.
okay,
And questions. If you have any questions, ask them.
okay.
Very, what are your questions?
Sorry, my network is very weak. Sorry.
That's fine, Very. So what are your questions?
No, I don't prepare. I will prepare now.
So prepare.
Okay.
Hello, Rami. Hello, Rami. Hello, Khulud. What are your questions for today? Hello, Sandy. Your questions. Sandy, hello. So what are your questions for today? Sandy and Khulud and Rami, can you hear me?
I just did.
So what are your questions and what topic have you prepared for today?
I have no questions, I think.
So which topic have you prepared?
Neurodegenerative diseases.
Okay, so what kind of diseases do you know?
No, I don't remember.
So there are two types of diseases: Parkinson disease and Alzheimer.
Mm-hmm.
So what do you know about Parkinson disease?
As much as I remember, it was an like imbalance between between dopamine and acetylcholine, I think.
That's correct. Please continue.
That's all. That's what I
all.
remember.
So, do you remember it from biology or
No.
physiology? I think, right?
Actually, I
Pathology.
kind of no. I use Google.
Google.
Like if I don't understand something from the book, I use Google.
Okay. Actually, it's explained pretty straightforward in the textbook. What is the disease, symptoms, etc. And there are also even the movies about the Parkinson disease. So there is one movie when about the old times in 17th, where a man is falling in love in a woman, and she has a Parkinson disease, and then in 70s there were no effective medicine, and then she's trying to find a physician that that make research in this field, and she is trying to help other patients with the Parkinson disease, so especially children, because they have some problems that prevent them from using the clothes or and also especially in children development and uh, maturation, Parkinson disease is not very pleasant. So she makes some meetings with other patients with Parkinson disease and teach them how to overcome the symptoms of Parkinson disease, that is actually the movement impairment. So and he tries to find a medicine actually, and
This Anne Hathaway, the actress, I think.
yes, she is.
Yeah, Love and Other Drugs, right?
Maybe I don't
Yes,
remember.
I think that's the name of the movie.
So you watched the movie, right?
Yes.
Okay, good. So if someone didn't, so I recommend you. It's a good one.
Yeah, it's a good movie. I actually watched it when I was younger, but I remember it.
Okay, so it's not a so it's old movie, like, and I think it's like 20s or 90s. So um, and at that times the effective medicine was not yet discovered. So but nowadays there are so much effective medicines, so that is why you should learn them. And the most common medicine used is levodopa combined with carbidopa.
Yes, I read this in the book.
Okay, so and there are a couple of other medicines too that can be combined or used seldom. So then you should read them too.
Medicines?
Sorry? Sorry,
What
Sam?
should I share?
What?
What should I share? You said you should share them too.
You should learn them too, not share.
Oh, okay, sorry.
So and unfortunately there are some side effects that make the treatment not pleasant, and So most of the side effects are antipsychotic, and so the medicines are not pleasant. So, but the treatment is a lifetime, and effectiveness is usually decreasing. The dose should be increased, and so the Parkinson disease is actually the reason for the Parkinson disease is uh, the lack of the dopamine uh, quality or receptors in the central nervous system, and uh, to decrease this lack, the dopamine is introduced additionally. So, and levodopa is actually the analog of the dopamine, and so it's the treatment is replacement treatment. So the central nervous system cannot produce enough dopamine, or there are lack of receptors. So we replace it with the increased amount of the dopamine that will activate the existing receptors. But unfortunately, the amount of the receptors is declining over the age, and that is why the disease is progressing. And usually, people will die eventually from the disease, but usually at the old age. So and usually the old patients are the disease is more severe, and the treatment is more complicated. So and eventually it becomes ineffective, and then the patients will die. But good thing is that usually happens at elderly. So and the disease is usually can be diagnosed in children, in young males and females. So males and females are equally diagnosed, and usually it diagnosed during the age of 20 to 30. These are most common. But there is no any age preference. Like any person can be diagnosed with the Parkinson disease, and so the symptoms include inability to make directed movements. Like if you have any movement that you make involuntary, like you are switching the light on when you enter the room, you don't think I need to raise my hand and press the button, right?
Yes.
So you just enter the room, and then your hand automatically switches on the light, because it's remembering where the button is, and so you don't think about that. So these movements are not so they are not uh, they are not so these movements are fine, so they are not impaired, but the movements, like when you are so when you think about these movements, so like I need to take this cup of tea, or I need to write uh, a, a word on the paper, or I need to tie my tie or button the shirt. or make a bow on the shoes. So these actions are so impaired in the Parkinson disease patients, so they cannot do that. So that is why they don't wear the t-shirt with the buttons. They wear t-shirts with the clips. So like your like if and coats also, like, do you have a coats with the clips? With
Do
the
you have a
pin?
what?
Sorry?
Do you have what?
Coat with the pins instead of buttons.
Ah, yes.
So they only use clips or pins, so no buttons. And for the shoes also, like they use like the Velcro straps. Do you have a Velcro straps on your shoes?
No, but I know Velcro straps.
So they usually are used in sportsmen because they don't have enough time to tie a bow on the shoes. So and for Parkinson disease, they cannot tie the bow, so that is why they use a Velcro strap or any others, like automatically strap. There are actually uh, a new types of the straps on the shoes that you just need to pull and then it will tie it automatically, or you have to rotate a switch, then it will tie. So and also the driving is not possible, so like, so there are some limitations on the movements and the activity that Parkinson disease patients can do. Sorry, and the treatment is lifetime, and the uh, the parts of the brain that are involved in the development of Parkinson disease are neurostriatum and substantia nigra. Substantia nigra and neurostriatum are connected to each other, so they inhibit each other. Like the dopamine neurons from that are located in substantia nigra, sorry, in neurostriatum, they will inhibit the substantia nigra, and the gamma and the GABA neurons or gamma aminobutyric acid neurons located in the substantia nigra will inhibit the neurostriatum, so they inhibit each other, and also the acetylcholine neurons, sorry, acetylcholinergic neurons are located in the neurostriatum, connect these pathways and also inhibit the dopamine, and they also make a correction of the movements, especially precise movements. So, and this correction is damaged during the Parkinson disease. So when patient is Parkinson. So exact reason for this is unknown, but the development is connected with this neurostriatum and substantia nigra, and sorry, the treatment goal is to increase the Parkinson, sorry, to increase the dopamine amount, and also to decrease the acetylcholine amount, because usually when the dopamine is decreased, then it will not inhibit the acetylcholine enough, so then there is excess of the acetylcholine, and that will result in the shaking hands and movements will be jerky. So and the third way is also to decrease the gamma aminobutyric acid. So that is why the drugs are, there are three types of the drugs that influence the dopamine, acetylcholine, and GABA or gamma aminobutyric acid. So these are.
Can you let Selma in? She just asked me she can't.
Sorry, Rami.
Can you let Selma in? She's trying to join. She can't.
I don't see his request for the joining. What is the name of the student?
Selma.
Salma?
Mm-hmm.
Salma, could you please tell her, please give her the link?
Okay. I think there's something wrong with the meeting because, like, sometime I can hear you, sometime I can't. At the very first beginning of the meeting, I couldn't hear you for 10 minutes, maybe more.
Me too. I had to get out of the meeting and join again maybe 3 times until I heard you.
Oh, maybe that's connection problem, because from my side I joined easily from the first time. Oh, but I started meeting at 8:50. Or sorry, 9 at, yes, at 9:50. So have you tried to start at 8 o'clock?
No.
No.
At maybe, yes, 9:50 or
At
9:55.
9:50. So we're starting now at 9:50 because the lectures are over.
Mm-hmm.
So if you're trying to start early, then it will not allow you to enter, I think. And are you sure the link is correct?
Yes, I tried only this link.
So I will post the link. So, and please send it to the other students, so, and check if it is correct, because maybe if the link is incorrect, then it will not allow you to enter, or if you copied it wrong. But also if you are entering from the same email you sent me before, then it should allow you to enter without accepting. So you don't need like, for example, Salma, she has the same email, Salma Abdallah 456. This is Gmail. So it will automatically allow to enter. I don't need additionally. Hello, Salma.
Hello, teacher. Good morning.
Good morning. So do you had any problems with entering?
Yes, I was just trying since 10 o'clock to enter, but it was not joining. I don't know why.
Joining FMLI?
Since 10 o'clock, I'm trying to join the meeting, but it does not let me in.
Okay. But now it's working, right?
Yes, Rami sent me the link.
I think you used the wrong link before.
Maybe because I have two mails.
Oh, so maybe you have two emails. Okay, so
Yes.
if you are entering from the wrong email, but it will still should allow you to enter, but I'm not sure why you couldn't. So if you use the same email, so first of all, the links are at the educational portal. So if you forget the link, go to the educational portal, find your group, and then the link is there. It is not changed. Or you can bookmark the link. Then if you have the same account on your phone or any other device, log in from this account, go to the calendar, and in the calendar you will have a remark, and it will actually remind you about the class time. So, and then you can click on this calendar event, and then there is a button there, join the meeting. So, and you can also select if you are going to this meeting or not going, or maybe you are going, and then you can see who is going with you. So, and then there is a button, join with Google Meet, and then you should press this button. It will go automatically sign you in.
Okay, teacher.
So the link for the calendar is actually, so I will post the link to the calendar in the chat, so check this one, and you can use that so you don't miss the lecture or the class. And if you have it in your phone, so it will remind you automatically. So if your phone account is the same as you sent me for the subscription. So let's continue. Or do you want to break?
No, maybe we can continue.
Okay, let's continue. So any questions you have? Salma, do you have
No,
questions?
teacher. No, thank you.
What
No.
what chapter have you prepared? Which chapter?
For pharmacology?
Of course for pharmacology, not for the botany.
Not yet.
Not prepared?
We still have also control today in biochemistry.
So when your controls are over?
No, just we will have our exam in January, so I don't know, like, we're trying.
So in January they will be over. And I hope you will start learning pharmacology then.
Yes, of course we will start before January, but just it's like
No,
lots of
start
things.
after the January. First complete with the biochemistry, and then after the January I allow you to start. Okay?
So we have 1 year and a half for pharmacology, right? 3 semesters, right?
Yes, it is. So you have 1 year to prepare. So still what during your, so when you done with your exams in January, you have a holiday. So so I encourage you to study during that holiday, so you don't need then to study during the semester. So
to not be in pressure.
sorry?
To not be in pressure.
Yes, it's because pharmacology is pretty comprehensive. So and actually you need biochemistry to understand. So like for even for some diseases like the insulin therapy, so the diabetes, and even the Parkinson disease is actually requires physiology, the pathology, biochemistry a little bit, I think. So you need this you need these classes done at the time you start the pharmacology. So so there are two diseases like Alzheimer and Parkinson's disease. We are at Parkinson's disease, and so actually before the starting the Parkinson's disease, I assume that you remember the synaptic, what is the synapses, what are the pathways, which pathways are excitatory, which are inhibitory, like there are like there are neurotransmitters that are excitatory, and there are inhibitory, and excitatory usually prevent to the increasing the movement of the ions and depolarization, and the inhibitory are usually lead to the hyperpolarization, and the inhibitory the classic inhibitory molecules are GABA or gamma aminobutyric acid, and the GABA increases the chlorine ion opening, and the chlorine ions will go inside the cell, and because chlorine is negatively charged, to decrease the potential. So and the central system is usually in balance between the excitatory and inhibitory actions. So, and when one of these neurotransmitters will increase or decrease, then there is imbalance, and this imbalance usually leads to diseases. So, and the Parkinson disease is usually characterized by tremors, muscular rigidity, and that results in, so actually this is a movement disorder. And also when the Parkinson patients start to moving, they cannot start fast. So first they are starting slow, and then they can then they can make the normal movement. So but they at the beginning they move slow, really slow, and then also they have the posture is also different, like and they walk a little bit different. So because they, when they start moving the hand or the leg, it's starting slow. So and Parkinson disease is very common in elderly. So after 65 years old, it's about 1%. So like and most of us will be Parkinson patients sooner or later. And there is also this Parkinson disease that is caused by the medicines, like antipsychotic medicines. But this disease, when the reason is the medicine, then it is reversible. So after discontinuation of the medicine, then the disease is over too. There is no need for the treatment. But if the reason is unknown, so then actually it is usually lifetime. So and there is also so except the levodopa, there is also other diseases that include the cerebrine, and cerebrine is monoamino oxidase inhibitor, so it's MAO-B inhibitor, and so do you remember what is MAO-A and MAO-B?
No.
Monoamino oxidase. We are familiar with this enzyme because they metabolize the acetylcholine. So there are two types of the MAO. There is MAO-B that will metabolize dopamine, and there is a MAO-A that will metabolize serotonin. And so selegiline is actually the selective inhibitor of MAO-B that destroys the dopamine, and that is why when we inhibit the MAO-B, that will decrease destruction of the dopamine, and then the dopamine will increase. Okay, so is it clear?
Yes.
So Rami, what is the MAO-B? Rami?
Not really sure.
Sorry?
Not really sure.
Sure what? What is the MAO-B?
The what?
MAO-B.
Maybe. I don't know. For
We
today,
just
I
discussed it. Are you listening?
Yes, I was listening.
Listen more carefully so you remember everything, because
Yes.
I will ask you that during the exam. So okay, then the cerebrine can be administered with levodopa, and it increases the action of levodopa that allows to decrease the dose, because levodopa becomes ineffective in low doses with the long-term treatment, and then you have to increase the the levodopa. But when you increase the levodopa, you get the adverse effects. So if you don't want adverse effects, then you have to combine levodopa with the cereglide. And the good thing about the cereglide is that it will not lead to the hypertensive crisis like other non-selective MAO inhibitors, and that is why it's better. So selective. So in pharmacology, usually the selectivity is good thing, and but still there are some adverse effects because cereglide is metabolized to amphetamine, and amphetamine is actually a street drug, so used for the recreative purposes. So, and amphetamine will lead to insomnia, and especially if it's administered afternoon. So that is why it is recommended to use the drug before the bedtime. And also there is a rasagiline. Rasagiline is not metabolized to the amphetamine and will not reduce the insomnia. So then there is other inhibitors. Sorry, there are other enzymes that destroy the dopamine and other catecholamines, and the second is catechol or methyltransferase inhibitors, and usually the catechol or methyltransferases or COMT will metabolize levodopa and usually the levodopa is combined with the carbidopa, and that is why there are also drugs to inhibit catechol or methyltransferase, and these are entacapone and tolcapone. So the entacapone and tolcapone are inhibitors of catechol or methyltransferase, and that decreases the concentration of methyl-dopa, and that increases the uptake of levodopa to the central nervous system. So entacapone and tolcapone are usually administered when the effect of the levodopa is decreased. So then there are antagonists of the dopamine receptor, and these are bromkriptine, that is obtained from the ergot, so it's plant derivative, and there are also non-ergotamine drugs with the same mechanism of action that are pretty new one. So these are the pramipexole and rotigotine, and also apomorphine. So morphine is actually an analgesic, but its derivative apomorphine is dopamine receptor antagonist. And the bromkriptine and other dopamine receptor agonists are used when the levodopa is not effective or the effectiveness is low. So the apomorphine is injectable and usually is used in the most complicated cases. But there are also many side effects. So the most severe side effects include fibrosis, and so actually it's very rare adverse effects, but potentially can be fatal. So, and then there is an amantadine. Amantadine is an antiviral drug, so it's used to treat influenza, but it also has an anti-Parkinsonian action. The mechanism of action is not exactly known, but it just works. So by some, so it's increasing release of the dopamine by blocking cholinergic receptors and blocking Nmda receptors. So Nmda is N-methyl aspartate receptors of the glutamate. So what exact mechanism is not yet understood, and there are also plenty of side effects, and it is less effective than levodopa. So usually the tolerance develops faster, but it is more is less effective, but also the side effects are fewer. Then there are anti-muscarinic agents or choline blockers, and they are also less effective than levodopa. So the cholinergic blockers, what cholinergic blockers do you know? Or anti-muscarinic agents? Khulud, Salma, Sandy.
I don't know.
Do you remember
Like,
anti-muscarinic? M
mm,
choline blockers. We started them like 3 weeks ago.
maybe acetylcholine.
Acetylcholine is agonist. We need antagonist. Do you remember atropine?
Atropine sulfate.
Yes.
Mm-hmm.
From chemistry
I think I do.
or technology? Because usually we call it atropine on pharmacology without sulfate. So
Okay.
there is a derivative of the atropine that is benztropine. So benztropine is used for the Parkinson disease treatment, and also 3-gexophenydyl and prostaglandine and other antimuscarinic agents are used to treat the Parkinson disease because there is excess of the cholinergic transmission. So when we block the cholinergic transmission, that increases dopaminergic transmission because cholinergic neurons will inhibit the dopamine. So to treat, like, we can increase dopamine or decrease the acetylcholine. So there is imbalance. So to correct imbalance, you need to increase one thing or decrease another thing. So that is why these drugs are also used, but they have much more severe adverse effects like the constipation, dry mouth, the jaundice, so the vision impairment, the blindness, the poor vision, the blurry vision, that is not very pleasant adverse effects. So that is why these agents are used very rare, and also they can lead to the mood changes and produce xerostomia. Xerostomia is the dryness of the mouth, and the most important adverse effects of antimuscarinic drugs is constipation. So do you know what is constipation?
Yes.
So what is constipation, Sandy?
Inability to excrete.
Excrete what?
Like
Poop.
excrete. I don't know.
Poop.
Yeah.
Like
Yeah.
inability to poop.
It's actually excrete is the wrong word because excrete can be urination too, so it's not excrete.
No, excrete actually cannot be urination. Urination is urination.
Isn't it a form of excretion too, like sweating?
Sweating is also actually excretion can be anything. like not only urination, sweating, and anything. You can excrete anything you want, like any substances. Like there are so many excretions in the body. So that is why you should be specific. To poop is actually the most uh, common complaining from the patients is inability to poop, or like pooping is usually very uh, painful, or the requires much time. So, and that is why these drugs are not very popular, because people want to poop. So, and they want to poop because they want to eat. So like they eat much. So, and then if they if they cannot poop, they cannot eat much, because their stomach is always full. So, and they can't put more food inside, but they want. So that is why it's like a very uh, most most patients complain about this. They don't complain much about the like dryness of the mouth or the vision impairment, because for the vision they can just put the things closer, especially when we have the smartphones, or like take a picture of the thing and then look on the smartphone and zoom it. So and then there is other disease, that is Alzheimer disease and or dementia. And Alzheimer disease is actually the disease that all of the people will feel it sooner or later. So if you don't die from the accident, so and you live a long life, up to 80s, then you will definitely have Alzheimer in your 80s. So all of people will have this disease if they don't die from other disease before the age of 18. So
Teacher, my grandmother didn't have Alzheimer.
didn't have
Oh.
what was
And she reached 95 years old.
95? How do you know she didn't have?
Because she didn't forget anything.
Alzheimer disease, not necessarily forgetting everything. So she like I agree that not all patients, but I mean the like 99%. But what was what from she died from?
No, just she didn't have any chronic disease. She just died.
Just died, sure. Because usually if uh, there is no such thing like a elderly disease. Like all people usually die from like cardiovascular disease, or some diseases maybe not very uh, symptomatic, like asymptomatic diseases. So that is why when the patients are old and they die, no one will try to find the the disease, because like we think it's normal. So maybe she died from the aging, like maybe from the disease, but it's hard to like to know exactly, because then you to know that you have uh, to go back and then check if she don't have any diseases. But when she died already, you cannot do that. So because not all diseases are symptomatic, like person can be ill but is not aware that he or she is ill, and then he or she will not visit the hospital, and
No, she used to visit, but like for aging, like when when people get old, they must be weak, like they don't see well, their bones become weaker. That's why she went to doctors. That's it. But any other chronic diseases she didn't have.
okay, but that depends actually. If the person is like has a strong will and also a fit body, then usually less prone to the diseases. So but most of the people have Alzheimer in the elderly, so and there is no treatment, so the treatment is not much effective. So the groups that are used for the treatment are so the drugs are only to help reduce the pain, and the benefit is not much effective. So the treatment is not to cure completely, it's only to help to survive a little time, so and disease is fatal. So the drugs that I use are anticholinesterase inhibitors. What anticholinesterase inhibitors do you know? These are indirect cholinomimetics. We already know them. We discussed them before.
Anticholinergic inhibitors.
Yes.
Now this will be acetylcholine.
No acetylcholine. These acetylcholinesterases inhibitors.
Acetylcholinesterase, which destroys the effect of acetylcholine.
Yes, but these drugs are acetylcholinesterase inhibitors. So they prevent this destruction. And what are the drug names? Do you remember neostigmine?
No.
Neostigmine is the classical. So do you watch Matrix movie?
No.
No? Sandy, have you watched movie Matrix?
Yes.
Yes, so it's like very popular, so very, I think, cultural movie. So what is the name of the main hero in this movie?
Neo.
Neo, exactly. So that is what neostigmine. Remember this, please. So neostigmine is actually the one of the first anticholinesterase inhibitors, but there are also other like rivastigmine and galantamine and donepezil. So these all these three are used as anti-Parkinson, sorry, anti-Alzheimer. And there are some of them that are available as transdermal patches. So they can be, so these are long-acting agents used transdermally. So not orally, but transdermally, that is preferred route. So the adverse effects are, do you remember the adverse effects?
Like of which disease or of the drugs?
Not the disease, but the anticholinesterase adverse effects. Like, do you remember them?
No.
Like when we inhibit the anticholinesterase, that will decrease the acetylcholine, then we have excess acetylcholine, and acetylcholine will lead to the stimulation of the muscles, smooth muscles and skeletal muscles, because you remember that acetylcholine will stimulate the M-choline receptors at muscarinic M-choline receptors and nicotinic N-choline receptors. So, and muscarinic, what are the effects of the muscat stimulation?
You said constipation and visual
No.
problems.
Constipation is inhibition from the atropine. It's
Mm-hmm.
vice versa.
Diarrhea?
Yes, diarrhea.
Uh-huh.
So this is the
Okay.
most common complaint from the patients also, diarrhea, because they spent much time in the toilet. So, and also nausea, vomiting, anorexia. These all are M-choline receptors. So this is a parasympathetic nervous system. And then the tremors, bradycardia, and muscle cramps are nicotinic adverse effects. So muscle cramps are because muscles are twitching, always contracted. So that is why they are tired, and then eventually you feel like, do you remember at the first year when were a freshman, what do you feel after the PT lessons, PT classes?
Tired.
Tired? And Sandy, Salma, and most, I think, other girls, what do you feel, ladies?
After which class, teacher?
PT, physical training.
We are tired.
Only tired. Next day.
No, maybe like muscle cramps.
Yes, cramps.
Mm-hmm.
So next day after your first PT lesson, I think you barely can stand up, right?
Ah, this is the day after, yes.
So,
Well, not this much, but but they hurt.
but
Like,
it hurts
yeah,
when you use climbing somewhere on the stairs, right?
yeah.
So this is the adverse effects of the uh, acetylcholine. So it's nicotinic receptors, so acetylcholine inhibitors. So, and also tremors, and it's shaking of the hands feeling. So then the next group is Nmda receptor agonists, and this includes memantine. So actually uh, one of the treatments, and it's well tolerated, and so it's a new drug. So actually NMDA receptors will open the calcium channels, and that allows calcium channels to enter inside the cell. And that is why memantine, that is NMDA receptor antagonist, used to treat the Alzheimer's disease, so it will decrease the calcium entry. And there is also a third disease that are also a neurodegenerative, that is multiple sclerosis. So multiple sclerosis is actually the memory disease. The and this disease is usually will develop during the 10 or more years, so it's not developing fast. There are different types of drugs used, so usually interferon B1A and B1B are used because the disease is autoimmune, like the body will produce antibodies for the for the it's for the cells itself. So that is why that is why immunosuppressive drugs are used, and also the symptomatic treatment is used. And multiple sclerosis is also seen in elderly, and usually leads to the memory problems and other disabilities. So the disease is inflammatory, and it will destroy the myelin that helps to conduct the signals faster. So like myelinated axons will faster transfer the stimulation. That is why communication is fast between the neurons. And then there are a group of the drugs, but still they are not much effective. So okay, these are all the diseases. There are also the amyotrophic lateral sclerosis. So like there is a multiple sclerosis, and there is a amyotrophic lateral sclerosis, that is ALS. So and the lateral sclerosis will lead to the diminished control of the muscle movement, so will not lead to the memory loss. And the drug is riluzole, that is also Nmda receptor antagonist. So and it is the only one drug that is indicated, and but sooner or later patients will need to use the ventilator support to prevent the death. So the drug will not cure completely, it will only improve survival time. So in the amyotrophic lateral sclerosis, patient end up in the reanimation room, so, and then will need ventilation. So they are actually lying on the bed only, cannot actually move. So this is very disabling disease. So these are all the diseases, or all the neurodegenerative diseases, or Parkinson disease, the Alzheimer's disease, multiple sclerosis, and amyotrophic lateral sclerosis. Any questions?
No, thank you.
No questions. So maybe you will have more questions when you start to practice and work with the patients, because many, especially in Russia, many elderly will visit the pharmacy, and then you can easily recognize these symptoms from these patients, but unfortunately the treatments are not much effective. So thank you for attending. So see you next week, and please prepare for the classes as much as you can. Rami?
Thank you.
So see you on next week. Bye bye.
Okay, bye.
Bye.